Make this new school year an opportunity for your kids to learn important life skills with Greenlight. Greenlight is a debit card and money app for families where kids learn how to save, invest, and spend wisely, while parents keep an eye on kids' money habits. Greenlight also helps families get into their fall routine with a chores feature that lets parents assign chores and pay kids allowance when they check them off. Get your first month free at greenlight.com/Spotify. Greenlight.com/Spotify.
Well, hello, I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach nursing concepts and share tips to help you thrive in nursing school and at the bedside. Today, this topic is more aligned with what a nursing student needs because we're talking about a very key component of your clinical assignments, your clinical experience, and your clinical homework, and that is SMART objectives. And students often have trouble with this, so I'm giving a breakdown of how to write SMART objectives in this episode. Now, before we jump into this, let's take a quick minute for our listener shout out. And this one goes out to Naomi, who says this: I am a massive fan of Straight A Nursing. The dosage calculations course saved my exams. I got 100% on every dosage exam that I took. Also, the Med Surg content and worksheets solidified terms and made complex concepts easy to understand. I highly recommend it to all my nursing friends. Well, Naomi, thank you so much for taking time to share your experience with Straight A Nursing programs. If you are not sure what Naomi is actually talking about, maybe you're new here, then she's talking about my dosage calculations program called Confident Calculations, where I teach you a foolproof way to do dosage calculations with 100% accuracy so you can get 100% on your dosage exams, just like Naomi did. And then the other program she's mentioning is the one in which I teach Med Surg concepts, and that is called Med Surg Solution, and it includes video lessons on over 60 disease conditions, and they each come with worksheets and downloadable study guides so that you can really solidify what you're learning. I'll put a link to both of these in the episode notes. You can also go to straightanursingstudent.com and just click on courses in that top menu bar. Alrighty, who's ready to talk about SMART objectives? So again, as a clinical instructor, I have seen that students struggle with this. And it's not just nursing students who struggle with SMART objectives. It's people all over the place. I've seen people provide coaching on SMART objectives to executives. So don't feel like you're not getting it because you're not smart, you're not accomplished. No, 100%. A lot of people have trouble with SMART objectives. I specifically see it in nursing students because I teach nursing students. So SMART objectives are going to be a key part of your care plans if you do a care plan for part of your clinical homework or any kind of clinical assignment where you're discussing or sharing your goals for the patient and their plan of care. It could even be in discussion at the bedside with your clinical instructor. They may ask you, what is your plan for this patient? What is your objective with these interventions that you're putting together for this patient? And you want to use the SMART format, and that's an acronym. Is it an acronym or a mnemonic? I always forget, but the SMART all stand for something. And then once you have your SMART objective, it's going to provide absolute clarity about what this goal is. So something to be very, very aware of is that you're not writing your SMART objective in isolation. It's not something that just exists out there all on its own. It's very, very closely tied to the patient's problems and the interventions you are doing to address those problems. So as you're writing your SMART objectives, you want to make sure that everything is in alignment. So here's an example. If your patient's problem is a knowledge deficit or a lack of understanding about something, then your interventions are aimed at increasing their knowledge and evaluating their level of understanding. So your SMART objective must be related to improving their knowledge deficit or improving their lack of understanding. And you might be wondering, why am I using a phrase like knowledge deficit when a lack of understanding is more clear? That's because many schools still require you to use NANDA nursing diagnoses. And I'm not going to lie, nursing diagnoses can be really confusing for students because the language is just weird. So you'll notice I could just say the patient doesn't understand something, right? That's plain language. But with NANDA, we say things like knowledge deficit. So that's why you hear me saying that. And all the examples that I'm going to share with you in this episode today will be using NANDA. Just because if your school is teaching you to use NANDA, I want to use the same language so that you get used to it, because the more you hear it, the easier it gets. And then I'll translate it into plain language for those of you who are not using NANDA, though I think you'll get the gist of it. So when we talk about things being in alignment, let's go through a quick example to really drive this concept home. And then we'll dive into the specifics of SMART objectives. So for our first example, let's look at one where we are not in alignment. So the patient has a problem of a knowledge deficit related to his blood pressure medication administration times. Or in other words, patient is basically saying, "Hey, Nurse Mo, I don't know when I'm supposed to take these pills." Okay, so that's a problem, right? We don't want our patients to not understand their medication administration times. So our SMART objective, if it's not in alignment, could look like this. Patient will maintain a systolic blood pressure less than 160 millimeters of mercury by next appointment in 3 months. And then we have our interventions. So when we're not in alignment, our interventions might be teach patient about medication administration, measure blood pressure, and watch for adverse effects. Now, in this example, do you see how the objective, which was patient will maintain a systolic blood pressure less than 160, and some of the interventions don't actually align closely with the problem? Yes, they're related. They're all about his blood pressure, but they're not all related to his lack of understanding about when he's supposed to take his medication. You see how specific that is? So let's now look at an example that would be in alignment. So our problem is knowledge deficit related to medication administration times, as evidenced by patient's statement, "I don't know when I'm supposed to take this medication." Okay, so that was a problem written out in complete NANDA nursing diagnosis format. And you can see how it's a little convoluted. Basically, your problem is Bob's telling you he does not know when he's supposed to take his blood pressure pills. So your SMART objective, when it is in alignment with the patient's problem, would be something like this. By time of discharge, patient will be able to state that his medication should be taken every night before bed. So can you see how that objective is very, very closely aligned with the problem of the patient not understanding when he's supposed to take his medication? Yes, of course, it's in alignment. And then the interventions also need to be in alignment. So all of our interventions are going to be about teaching in this case because it is a knowledge problem. So interventions might be, hey, let's start by just assessing what he does know about his medications, right? It's always really good to get a baseline understanding of where the patient is coming from. Another thing is obviously going to be explaining to the patient the frequency of when he's supposed to take his medication, when that is. And then another great thing to do with your patients who have knowledge deficits is to utilize teach back, where the patient teaches it back to you to demonstrate their understanding. So in this example, everything aligns with that patient's lack of understanding or their knowledge deficit. The patient doesn't understand when he's supposed to take his medication, so we've set a goal or a SMART objective that he will understand when he is supposed to take it and will intervene with effective teaching. And when everything is in alignment like this, then you know you're truly addressing your patient's problems. So let's take a quick break and then we'll dive into the components of a SMART objective and look at how we're going to write basically care plan components around that again are all in alignment. I recently threw my husband a big birthday party. And you know what? Between the decorating, the cupcakes, the food, it was a lot of work. But one part was actually pretty easy, and that was the wine. Because I'm a First Leaf member, I already had wine on hand, and I knew all of it was going to be good. And that's because First Leaf is a wine club that is completely personalized. They take into account what I actually like and hand select wines that are just for me. Plus, if I've got an event coming up, like a family dinner or a birthday party, I can opt for First Leaf's Fine Wine Upgrade to get a really special bottle that's sure to impress. Now, since it's summer, I've been enjoying the white and rosé wines from First Leaf. A couple of my favorites have been a Chenin Blanc from South Africa and a Vermentino from Italy. So bright and refreshing on a hot summer day. Plus, I love how much I can tailor my membership. I can choose 6 or 12 bottles, get the perfect blend of red, rosé, and white, and this is the best part, select a shipping window that works for me. Get wines to sip and share all summer long with First Leaf. Go to tryfirstleaf.com/nursemo to sign up, and you'll get your first 6 hand-picked bottles for just $44.95. That's tryfirstleaf.com/nursemo. tryfirstleaf.com/nursemo. Now we're diving into the components of a SMART objective. So each letter in SMART relates to a key component of how you're going to structure these. So S stands for specific, M stands for measurable, A stands for attainable, R stands for realistic, and T stands for time bound. So let's go through a few examples so you can see SMART objectives in action. Now, again, for these examples, I am using that NANDA nursing diagnosis language. And if we come across one that's a little on the weird side, I will translate that into plain language for you. The most important thing is that you understand how to create a SMART objective and make sure it's in alignment with your patient problem. All right, so for example number 1, your patient's problem is risk for constipation related to opioid use as evidenced by hydrocodone being administered 4 times on March 24th and March 25th. So in other words, your patient's been taking hydrocodone. This is putting them at high risk for constipation, so that is their problem. Our SMART objective is patient will have at least 1 bowel movement by 2300 today. And let's say it's 9 a.m. So let's go through each of the components to see if it meets our criteria for being specific, measurable, attainable, realistic, and time bound. So S is specific. Is this objective specific? Patient will have at least 1 bowel movement by 2300 today. Yes, this is specific. We could have just said, patient will go to the bathroom, but we've been very specific about what we're talking about. We want this patient to have a bowel movement. Next is asking ourselves, is this measurable? What did we say in that objective? Patient will have at least 1 bowel movement today. Yes, we can measure that. At least 1 is measurable. We can count to 1, right? The next letter is A. Is this attainable? Yes, this is attainable, and you'll learn more about what's attainable and what's not attainable as you get more nursing experience. This will, of course, depend on the interventions that you're planning. If your interventions are lame, then no, it's not going to be attainable. That's why everything must be in alignment. So, again, this is attainable because of the interventions we're going to do. And we'll talk about those in just a moment. R is realistic. Is this a realistic goal? At least one valve movement by 2300 today. Yes, this is realistic. And what you'll notice many times is that if the goal is attainable, it's also realistic. Again, this depends very much on the interventions you're planning and how much time you're giving the patient to reach this goal. So that brings us to the final component, which is that T for time bound. Is this time bound? Yes. We want the patient to have a bowel movement by 2300 today. So this statement, patient will have at least one bowel movement by 2300 today, is a beautiful, smart objective. But it does need to be in alignment. So let's look at our interventions. They must be tied to the problem of the patient being at risk for constipation. So, what are some interventions we can do for a patient who is at risk for constipation? We can increase their fluids. We can increase their activity. We can administer any laxatives or stool softeners as prescribed. We can administer an enema if that's prescribed. And we can go to the nutrition room and get some prune juice for the patient and encourage them to drink that. So if we did all these things for our patient, took them some prune juice, encouraged them to drink more water, get him up and walking, maybe give a laxative or a stool softener, maybe an enema if they're really, really high risk, then guess what? Really good chance they're going to have a bowel movement by 2300 today. So that is a great example of keeping everything in alignment. All right, let's do another example. Here's our patient problem in NANDA language. Activity intolerance related to fatigue as evidenced by the patient refusing physical therapy on 415 and 416, stating, I'm too tired to get up. So, in plain language, what is your patient's problem? They have not been getting out of bed. They won't even do their physical therapy because they are too tired to do it. So, let's write a SMART objective for this patient because we don't want our patients just laying around in bed, right? Lots and lots of problems with immobility. So, our SMART objective is patient will ambulate 10 feet using a walker by 1400 today. So let's go through the components. Is this specific? Yes, it is very specific. We could have just said the patient will increase their activity. Well, is that specific? That could mean they could increase activity in bed. We want to be very specific here. We have said exactly what we want them to do. Next, is it measurable? Yes, it is. We can definitely measure out 10 feet. A, is this attainable? Yes, it is. This is attainable because we've incorporated the use of an assistive device and we've made the distance only 10 feet. If the patient's been in bed for a couple of days, we're not going to give the assignment to them to ambulate 100 feet. That may not be attainable for them, but we've made it attainable. With that said, we've also made it realistic. Again, attainable and realistic often kind of go hand in hand. And then, is it time bound? Yep, we want to have this goal met by 1400 today. So the SMART objective, patient will ambulate 10 feet using a walker by 1400 today, is a fabulous SMART objective. Again, we also want to make sure that it is in alignment. So the problem was the patient's decreased activity level. Our objective is going to get them to very specifically increase their activity level. Our interventions must all be related to the patient's activity level and helping them with that fatigue that's causing this activity intolerance. So, what are some things we could do for this patient? We are going to encourage this patient to participate in physical therapy, even if they're tired. Do what you can, Bob. Okay. It's really important that we get you up and moving. We don't want you to get pneumonia. We don't want you to get deconditioned. I know you want to go home. This is how you leave the hospital. You walk out of the hospital, meaning increasing activity enables patients to really meet their goals just overall and is one of the best and most basic things that you can do with your patients. So, we're going to encourage Bob to participate in physical therapy. We also want to see what could be contributing to Bob's fatigue problem. Does he have sleep disturbances? Is he having insomnia? Maybe there's something we can do about that. We want to balance activity with rest. We're clustering our care. We're giving Bob rest periods. And we also want to look at utilizing non-opioid pain management modalities if that's appropriate. Let's say Bob was in for some kind of surgery and he's having a lot of pain or he's having, discomfort of some kind and he's been getting a lot of opioids. 100% that's going to make him fatigued and not necessarily want to get out of bed. So maybe we can use some non-opioid pain management modalities. And then we also want to promote adequate nutrition. If you're not eating, you're not going to have the energy to get out of bed and participate in your physical therapy. So that's another example of a SMART objective that is in alignment with the patient's problem. The problem had to do with their decreased activity because they were too tired. Our objective was to get them to ambulate a very specific distance with a specific assistive device at a specific time. And then our interventions are all going to be looking at addressing what could be causing the fatigue, helping to alleviate that, and encouraging more physical activity. All right, one more example using a psychosocial type problem. So in this case, our patient's having some anxiety related to their hospitalization as evidenced by the patient's statement, "I don't know who is going to take care of my kids while I'm here." All right, so we've got a patient problem in plain language of a patient who's really anxious and nervous and uncertain about their childcare situation while they're in the hospital. And you will see things like this all the time. I know if I was in the hospital and there was nobody at home, I would 100% be a bit panicked about who is taking care of Oliver, my cat, right? So you can understand someone's in the hospital, maybe they're a single parent, they've got kids. What are they going to do? High anxiety here. So our SMART objective needs to be in alignment with their anxiety level, right? So we're addressing their anxiety level. And that might be the patient will rate their anxiety about childcare at level 4 or lower on a 0 to 10 scale by the end of the shift. So is this in alignment with their problem? Their problem is they're really, really anxious about who's taking care of their kids. Our objective is their anxiety level about that is going to come down. So is this specific? Yes, it is. We know that the patient's anxiety is specifically related to their child care situation. We could have just said, patient will feel better by end of shift, but that's not specific and could be interpreted in a lot of different ways. Is it measurable? Yes. By using a 0 to 10 scale, we make something that is very subjective, very measurable. The patient can tell you their anxiety level before interventions was a 9, and then after interventions, it's a 4. 100% that's measurable. Is it attainable? Yes, this could be attainable. Of course, it is going to depend on the time frame and the chosen interventions. And then, is it realistic? Notice we didn't say that the patient was going to rate her anxiety as a 0 because honestly, that's not going to happen. Any parent in the hospital is going to have some anxiety about their children while they're there. We want it to be at a manageable level. So we chose the level of 4 because that seems more realistic. And then, is it time bound? Yes, it is. We're going to help the patient reach this goal by the end of our shift. So, in order for all of the components of the SMART objective to make sense, we have to have interventions that align with it. So, what are some things that we could do for a patient who's having some anxiety about their childcare situation at home while they're hospitalized? One thing we could do is we could obtain an order for a social work consult. Social worker can come in, talk with the patient, provide some counseling with them, and help them identify resources that could be helpful. We also want to provide therapeutic communication with our patient, allow them to express their feelings, provide that safe environment for them to do so in an understanding and compassionate way. And we could help the patient identify and reach out to one or two potential caregivers. We could maybe bring them the iPad. Maybe the hospital has an iPad so that the patient can participate in a FaceTime call with their children. That would certainly help their anxiety level, right? If they see that their children are being well cared for at home. And we can also teach coping mechanisms. So, all of these things are going to help the patient reduce their anxiety about this child care situation. So I hope this quick tutorial on SMART objectives has helped you understand how to construct them and how to align them with the patient's plan of care. And if you are a new nursing student, you're looking for more help with nursing school, I have created a nursing school prep course called Crucial Concepts Bootcamp. I'd love to see you in that. I teach foundation concepts, I teach study strategies, organizational skills, dosage calculations, and a whole lot more. You can get all the details in the link I've provided in the episode notes, or again, you can go to straightanursingstudent.com and click on courses in the top menu bar. All right, I will see you back here next week where we are going to be diving into a Med Surg topic that I will save for next week. So I piqued your interest, hopefully. We're going to be diving into Med Surg. I will see you then. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Have you ever wondered what the science says about certain foods, products, or treatments? Does chiropractic actually work? Should I only buy organic foods? Are GMOs actually harmful? Is adrenal fatigue real?
We've got you covered. The goal of the Unbiased Science podcast is to dispel misinformation and misconceptions across an array of science and public health topics. We love to debunk myths and help arm our listeners with information so they can make evidence-based decisions. Make sure to tune in to the Unbiased Science podcast to get all of your questions answered.